Thanks, David. Good morning, everyone. So I would first like to thank the rest of the planning committee to contributing to putting this workshop together with support from the Institute of Medicine staff. And the planning committee included roundtable members, Robert Kaplan, and is Robert here, Paula Lantz, where's Paula? I've seen Paula, not here yet, and Jeffrey Levy. Jeffrey? Yeah. And you can find list and bio sketches of the planning committee members and speakers in your meeting materials. Now, in the past 2 to 3 decades, our understanding of what creates and impedes health has evolved, and that has been aided by a growing evidence base in the field. We know that healthcare accounts for a small proportion of the factors that influence health, and that factors that reside in our socioeconomic and built environments, such as ranging from educational attainment to access to parks and safe neighborhoods, have a great deal more to do with whether we are able to live long and healthy lives. We have also seen an increased recognition of the fact that it takes partnerships and collaborations across sectors to actually alter some of the non-health factors that shape our health. And now today's agenda will focus on education and the complex network of relationships and influences that lead to better health among the better educated. Now, our agenda features speakers from both the public and private sectors, from education, healthcare, and also from the nonprofit worlds. Our 2 keynoters will provide not literal, but actually figurative sort of bookends to the workshop. So one will cover the evidence base and the bottom line in terms of our investments as a nation. And the 3 panels that we have today will cover a range of topics, including lessons on collaboration between the health and education sectors and descriptions of the ways in which health issues constitute barriers to learning. Now, this workshop is actually quite timely, and as Dave mentioned, actually builds on the last workshop in the fall last year. And it's, when we look at historically, there have been partnerships, fruitful partnerships between health and education. I think within the education sector, Brown versus Board of Education is a really good example in which the health sector actually contributed part of the evidence base around desegregation of schools, as well as some of the Mississippi Delta work that was done in the late 1960s, where the health sector also worked with education to improve community health outcomes and also education outcomes. So I am now pleased to introduce Bob Kaplan, who will provide a report on yesterday's meeting that was hosted by National Institutes of Health. And this meeting focused on the evidence for education improving health. I will share a few highlights from Bob's bio. I mean, you can read a long bio in the meeting materials. Bob is the newly appointed Chief Science Officer for the Agency for Healthcare Research Quality. And before taking this position, he served as the Associate Director for the Office of Behavioral and Social Sciences Research at the National Institutes of Health, and was previously Distinguished Professor of Health Services at the University of California, Los Angeles, and Distinguished Professor of Medicine at the UCLA David Geffen School of Medicine. Welcome, Bob.